Now let's continue with choking care. So what is choking care? So after giving compression, so by giving chest compressions and back blows or slaps to expel an obstructing object from the airway. So basically, a person will choke if something is actually blocking the airway. So it can be the obstruction, so there's something that's obstructing the passage of air. So what could obstruct the airway? It could be an anatomical obstruction or a foreign object that is actually obstructing the passage of air. So when you say anatomic, it can be that the tongue is actually the one that is directly obstructing the passage of airway, or it's a foreign object. It can be food or anything that is swallowed blocked the airway. Although basic life support can be given to any victim whose breathing and circulation stops, cardiac arrest victims are most commonly the type of casualty needing basic life support. So, dili kayo common daw sa respiratory arrest because one example of respiratory arrest is choking. So we don't have a problem when it comes to the pulse, presence of pulse, but it's actually the breathing that is obstructed. So, but the most common type, the most common cause of, or the most common instance, okay, that needs BLS is usually the cardiac arrest victims. Okay, so usually it's those with negative pulse and negative breathing. Okay, now survival from cardiac arrest depends on a series of critical interventions. If one of these critical actions is neglected or delayed, survival is unlikely. So basically, this could cause death. Okay, so again, survival will depend on a series of intervention. There are some who survive after giving CPR but died in the hospital. So it's actually not 100% that you could say that the victim will survive just by giving CPR. There will still be other series of intervention such as the ACLS, no? And the prolonged life support. Okay, so mo na siya different types of life support. Now, so the Citizen for CPR Foundation created the concept the cardiac chain of survival. So Mona, this is how they came up with the cardiac chain of survival. So what's a cardiac chain of survival? So this is very important that you need to familiarize this one. Okay, so what is now the chain of survival? So do not confuse yourself with the chain of infection. So the chain of infection is actually discussed sa funda nato, no, how we get those infectious microorganisms in the body. But this is now the cardiac chain of survival when we talk of first aid, okay, or BLS. Now, what is the cardiac chain of survival? So we have 5, okay? First is early access, meaning you're able to call immediately for help. You're able to immediately activate medical assistance. You called 911 immediately. Okay, now early CPR. You were able to provide CPR immediately. Again, 4 to 6 minutes without CPR, this could cause This could cause damage to the brain. 6 to 8 minutes of CPR. No, 4 to 6, no, damage. Now 6 to 8, this could already lead to permanent damage. And then 10 minutes up, this could lead to death. So again, early CPR is very crucial, okay, for the survival of your victim. Third one is early defibrillation. So how do we provide defibrillation? That is through the use of the device which is called the AED, Automated External Defibrillator. Okay, so the earlier the shock, the better chances of recovery. Okay, so the earlier, nga naman, are we first aiders able to provide shock? No, we provide chest compressions and we provide rescue breath. But the only device that could give the shock is the AED, and they are the only device that could analyze the rhythm of the heart. Okay, so there's an electrical it's electrical stimulation, no, electrical shock that is provided para makamata si heart. and it's only provided by your AED. Now, early ACLS, meaning paspas na abot si medical team, so the victim was immediately brought to the hospital and provided other interventions that could help with the survival. Okay, early ACLS. So the sooner the victim is treated by emergency care professionals, the better are the chances for survival. Because you will know that if the accident happened in an area which is a bit difficult to find or difficult, dili siya accessible for the medical team, obviously, taas kayo ang risk for the victim to die. Diba? So, bisag ikaw, even you first aider, you were able to provide CPR to your victim. If the victim survived and dugay kayo naabot si medical team, then pwede na siya nga mamatay si victim. Okay? So, it's not your fault actually. You don't need to blame, you don't have to blame yourself as long as you did everything you can to help the victim survive. Okay, now the post-cardiac care, so this already happens in the hospital when the medications are already given, surgical procedures, no, kung kinahanglan surgery to the brain, surgery to the heart, this is already done sa post-cardiac arrest care. Okay, so dito na. So, sudden cardiac arrest, no? It can be due to probably something blocked the circulation sa brain or something blocked the circulation sa heart. So, it is now provided, no? So, kung nahatag na yun ang post-cardiac care, then there's a big percentage that the victim will survive. Okay, so this is now the chain of survival. So, these are the 5. No, so this is the chain. Early access, early CPR, early defibrillation, early ACLS, and of course, post-cardiac arrest care. So, ongoing care. Now, these are now the procedures when it comes to giving choking care for adults. Now, again, choking care is an example of a respiratory arrest. Why? Kay naglisod o ginhawa, pulse is present, but it's just the breathing that is actually obstructed. Okay, so caring for a choking adult. So what are those given? You give 5 back blows. So on a standing position, you position one arm over the patient's chest to support the chest, and then the other dominant hand should be the one that will give the back blows. How many back blows? You will be giving 5 back blows. Okay, now abdominal thrust, this is now what we call the Heimlich's maneuver. So above the umbilical cord or the umbilical region, that is where you should position your fist, no? Fisted hand, and then hold it with your non-dominant hand. You know, just have to push backward and up. Okay, in order to, unsa man, para ma-push not whatever is that object that is obstructing the airway. And you do it five times as well. Okay, that is what you call abdominal thrust. Now, there is an exemption. If the victim is pregnant or the victim is obese, no, medyo dako ang yang tummy, then you do the chest thrust. Okay, you go upper. And then you give, no, you give the same push, you push backwards and up para magawa si whatever it is, that foreign object that is blocking the airway. Okay, so that's for choking adult. Now you have there care for a choking child. Now for a choking child, you need to adjust to the height of the child. So you will allow the child to bend over your thigh. So you'll be kneeling, no? You kneel. You'll do the kneeling position, still the same. You give 5 back blows. You need to be supporting the child's chest, and then 5 abdominal thrust. Okay, if the abdominal thrust is not working, then you can always do the chest thrust. That's alternate, 5 times for the back blows, 5 times for the abdominal thrust. Now, for the infant, so this is how you position the infant. So over your lap, the head must be lower than the body. Then you give the back blows, no? Still 5 back blows. And then you do the sandwich turn to make sure that you'll be able to turn the child to the supine position in a safer manner. Okay, sandwich turn, and then you check the mouth, okay, before you give the abdominal thrust. After giving the 5 back blows, you do the sandwich turn, and then you check the mouth. Never do the blind sweeping. Again, just look at the mouth if the object is already visible. Now, if it's still not visible, continue with chest thrust. That's 5 chest thrust, and then do the back blows again, and then do the same. Okay, do the same step or procedure until the object comes off. Now, if the object doesn't come off for the rest of the victim, be it an adult, be it a child, or be it an infant, then just do the step-by-step procedure again until it comes out. Now, if the victim becomes unconscious, check the pulse, check the breathing. If negative pulse, negative breathing, then you always need to call for help immediately. Again, for a child, you do the CPR first before calling help. For a child and an adult, you activate medical assist, call 911 first, and then you proceed with CPR. Again, if it's an infant or a baby, you do CPR first before calling 911. For a child and for an adult, you call first, and then you proceed with CPR. Okay, so these are now the different procedures when doing the CPR for an adult. So I've already sent you videos on how to do the procedure. So this is also one way that you could familiarize the steps and you can practice it at home. Okay, so CPR for infants, CPR for a child, and CPR